Dr. Anand, can you hear me?
Yes.
Okay. Today, in the media conference with Lal Goel, which is brought to you by V4 News, Global TV, V4 Stream, say Samvad Sarokar News, Organ Donation India Foundation and Gyan. Our endeavor is to enlighten you with the current topic. And today our topic is COVID returns, impact on lady doctors. Yes, I am a lady doctor. Stethoscope is my jewelry, which is more expensive than gold. Girls with makeup looks good, but girls with a stethoscope look the best. Nobody wants to educate a girl, but still they want a lady doctor for their wife's delivery. Why? The presence of women in medicine, particularly in the practicing fields of surgery and as physicians, has been traced to earliest human history. Women have historically had lower participation levels in medical field compared to men, with occupancy rates varying by the race, socioeconomic status, and geography. Women's informal practice of medicine in roles such as caregivers or as allied health professionals has been widespread. Since the start of the 20th century, most countries of the world provide women with equal access to medical education. Not all countries ensure equal employment opportunities, and gender equality has yet to be achieved within medical specialists, and around the world studies suggesting that female doctors may be providing higher quality care than male doctors. The involvement of women in the field of medicines has been recorded in several early civilizations. An Egyptian of the early dynastic period or Old Kingdom of Egypt, Merit-Path, described in an inscription as chief physician, is the earliest woman named in the history of science. Agamemnon was cited by Homer as a healer in ancient Greece before the Trojan War. Agnodis was the first female physician to practice legally in 4th century BC at Athens. Metrodora was a physician and generally regarded as the first medical writer. Her book on the diseases and cures of women was the oldest medical book written by a female and was often referenced by many other female physicians. She credited much of her writing to the ideologies of Hippocrates. There has been big talk about the gendered impact of COVID-19, but hardly any affirmative action has been taken to mitigate the same in respect of our precious female healthcare providers. These warriors do not reach home to find hot meals ready to be served to them. Most of them have to first prepare those meals upon reaching home, deliberately sidelining their mental and physical fatigue over family well-being. In the case of female doctors on the front lines of the battle against coronavirus, they do not return home to comfort or get comforted by their children and family. They reach a sanitized facility away from their nest. Housing the doctors serving in Delhi government's hospital on COVID-19 duty in hotel to contain the spread is a thoughtful initiative, but does not take into account for gender-related challenges. For instance, what about the household of a female doctor? What about her children, their meals, homework, etc.? Likewise, it is understandable that the leave of all kinds stands cancelled. No one is asking for those either. One has to scratch the surface a bit to realize that the hardships faced and the unequal effect that COVID-19 generates on physicians who are females and mothers is unequally distributed and totally skewed. With domestic help not being available or not advisable, and with child care facilities shut because of social distancing and lockdown, it is inevitable, particularly in the Indian socio-cultural scenario, that the responsibility of doing most of the babysitting, homework, support, cooking, laundry, and grocery shopping, etc., fall on females when compared to their spouses or partners. How then can the female medical staff be kept on the field doing their duty without being unjustly burdened in mind, body, and spirit? Of course, a more equitable distribution of the above mentioned work among physician mothers and their spouses, partners, family members might bring in a respite, but that expectation to manifest, it requires a massive and immediate behavioral shift, which might be desirable but is utopic or bookish at any rate. And when we talk about COVID returns, yesterday on 5th May 2021, India registered 4,12,618 new cases of coronavirus, which has taken the country's cumulative tally past 2 crores 10 lakh 70,000 cases. Yesterday, 3,982 lost their life. Thus, total death due to corona raised to 2,30,151. And mind it, this is an official figure. I cannot vouch for these figures because the actual of the facts which are shown in the media is quite disturbing and quite high. According to health officials, India has administered 16 crores 4 lakhs 94,188 vaccines doses across the country as of yesterday, that is 5th May 2021. The National Registry of Indian Medical Association, IMA, shows that 747 doctors have died of COVID-19 as on 15th April 2021. First of all, we pay our tributes to all the doctors and all the health workers who lost their lives for saving the humans or the mankind. And we also advise all the persons who are viewing this show, please try to be safe, behave as you have to be live, because whatsoever you are doing, if you are doing irresponsible behavior, you are burdening the doctors and the health workers and the hospitals, and then you are blaming the government. Now, coming to our topic, that is COVID returns impact on lady doctors. Today, we are going to discuss and take the views of leading doctors. They are leading in their own field, and they are facing this COVID situation, how they are coping up with the hospital work, with their houses, as well as in the society, the social work. So to discuss this, we have a very elite panel with us. First, I would like to invite my first guest, and he is Dr. Rajiv Anand. Dr. Rajiv Anand is a senior psychiatrist and marriage counselor. Dr. Rajiv Anand passed his MBBS in 1976 and did MD in psychiatry in 1980 from King George's Medical College, Lucknow. He opted to serve his country when it was very common to settle abroad for brighter future. He has been serving society with his base in Mumbai. He has clients all over India as well as in many other countries. He was honored with Lifetime Achievement Award by AMA. He has conducted more than 3,000 workshops for different groups and companies with audience size of 10 to 800. His television program on various channels have been widely appreciated for his forthright and practical approach. He is leading in the field of mental and emotional well-being for more than 40 years. He was president of IMA for 2 times. He was interviewed in several talk shows in domestic and internationally. Welcome, Dr. Rajiv Anand, on our show. Dr. Rajiv Anand, as you know, COVID has become a havoc, especially at this time. Today, India is having the maximum number of cases reported, although we are doing very less number of tests. So many restrictions have come because the test kits are also not available, and the reports are taking 4 to 5 days, even more. As well as the number of deaths are also, I must say, they are number one. I think some disturbances are coming. Yeah, they are also number one in the country, in the world rather. So when this is the situation and everyone is facing problem, but one class which is facing the maximum trouble, or they are working from the, I must say, from the day the once we have started and when we realized the COVID has come, that is somewhere in early March 2020. And without taking any rest, tirelessly they are working. That is the medical fraternity. And in that also, the responsible work is done by the doctors. And in that category also, if we see, the more responsibility lies with the lady doctors, because they are not only treating the patients, they are also psychologically also giving them so much console, not to them and even to their family members, as well as their own family. And in that condition, you being a psychiatrist, leading psychiatrist, as well as very senior marriage counselor, you might be dealing such types of cases of the doctors who are getting set so much trauma. Because in one of my earlier program, I asked these questions to the doctor, because today, for want of oxygen, so many patients are dying. When a doctor wants to save the patient, and the disease is more, that patient is not going to save, then doctor, yes, they get some worked up, but not that much. But when the doctor knows that this patient can be saved, but there is no oxygen, and this doctor is dying for want of oxygen or for want of some medicine, they are really very, very much mentally upset. And we have seen on the national media how the doctors started crying, broke down on the national media. And I asked this question, they says, yes, very traumatic condition. You being a psychiatrist, you know far better than all of us. So now we would like to know from you, COVID returns, impact on lady doctors. Dr. Rajiv Anand, please.
Thank you, Mr. Lal. Good morning to my colleagues, Dr. Girija Wagh from Pune, Dr. Bhavika from Bombay, Dr. Anjita from Sri Ganganagar, and Dr. Gauri Gupta from Mumbai. And all the viewers from Kerala and Karnataka and UP and Bihar and other countries through the global TV and through Facebook and through YouTube. In fact, when we took up this topic about lady doctors during COVID returns, many people laughed at us. Many people questioned us, why this topic? Even till this morning, I've been receiving questions from various groups, why emphasis on lady doctors? Doctors are same, lady or gents. Why you're talking about lady doctors? And that's what make me feel tempted to make me responsible to answer this question, that perpetually, globally, all over the world, all throughout the ages, all the ladies have had a standing complaint that nobody understands us. All the wives, all the girlfriends, they have perpetual complaint, nobody understands us. So this is again the time that nobody understands us. First thing, that during this most difficult time which each one of us have faced individually as well as nationally as well as globally, how many leaders, how many socially conscious people have ever thanked the medical fraternity for not going on a strike, for not showing any kind of resentment, or not showing any kind of anger or frustration about working in this difficult time when they are in the PPT kit and they are covered top to bottom. They can't have a cup of tea as and when they want. They can't go to washroom as and when they want. They can't talk to their children as and when they want. And they have been working tirelessly. They have been working endlessly. They've been working with no light at the end of the tunnel. How many state leaders or center leaders have paid thanks to the medical fraternity? Isn't that due? Much more than that, I would say the female doctors, how often we have read any single news item when a lady doctor has said, I have so many other responsibilities at home or in other areas of my life, and I'm taking a leave for a month or for 3 months or for 6 months or for 1 year because this is a very difficult time. Rarely ever we have come across, I have not come across any news item where a woman has opted out of her responsibilities and duty. Now, why we are talking about lady doctors? Because the reason is very simple. We know lady only as lady by virtue of her body. That's all about. We know lady because by virtue of her hormones. We know lady by what she cooks at home and how she takes care of everyone in the family. We know lady as a mother. We know lady as sister. But there are different aspects of a lady's constitution, lady's physical constitution, emotional constitution, hormonal constitution, which we have very little knowledge about it. I have no qualms, I have no hesitation in saying, despite I being in my age, late 16, despite being in the profession for more than 40 years, I cannot lay claim, I cannot say that I have understood women. No. I'm understanding them. And I can't be very categorical or very confident and very dismissive that I know women. I used to think when I was young that I understand women. As I grew, I realized how much I do not know. And I really feel sorry for thousands, not thousands, rather millions of husbands and millions of men in the society who dismiss women. So what? They are doctors. They are earning money. So what? They are doctors. They are doing their duty. No. Much different than the man who, when he walks out of the home to go to the hospital or to the clinic, he has nothing to carry in his hat except that he has to perform his duty. Much unlike a man, woman has many responsibilities. She has many being social being alike, separate, emotional being separate, family responsibilities separate, mother being separate. So many people back home waiting her to return. So many back home need to be taken care of, need to be nourished. And her own needs are in her own body, and her own body's various problems, ups and downs of the life. Much unlike a man who just walks out of the home after the breakfast, he doesn't have to look back. He can focus on his job, on his responsibility, almost 95, 99%, and forgetting anything and everything else in the life. He didn't have to bother. As Mr. Lal when he began, he laid the ground for it. A lady has to take care of her husband, her children, in-laws if they are at home. And last, if sometimes some energy is left for her own self. That's what people call me time. Now, nobody is bothered about it. One more point which I would like to draw attention to all the gynecologists in this group, and as well as Bhavika, as well as Anita, who is very fast coming up psychiatrist, that do people get time to nourish themselves, women, lady doctors? Because they are expected to take care. Every patient look up to a lady doctor because she would be nice, she would be kind, she would be soft, she would be motherly figure, she would be sisterly figure, she would always be smiling, she would always be pleasant. All of us frown when we see some lady doctor who is always angry or irritable. We see her not as a complete woman. We look at her, no, she's not doing her duty well. She should always be smiling. Have you ever bothered from where does she get this nourishment? She's all the time on duty. Male doctors are on duty on one side, female doctor is duty 24/7. Male doctor have to bother only about the logical aspect of the life. A lady doctor has to bother about so many aspects of life. Spoken, unspoken, discussed, undiscussed. When they go out of the home, they just don't go out totally 100% away from the home. They carry within their mind. They carry within their mind various responsibilities. And one more important aspect Anita would find interesting enough is that since so many pictures, so many responsibilities are going on simultaneously in the mind, and they are battling in their mind, they're struggling in their mind to keep them in the backyard and continue with the front duty, whatever it is, as a medical doctor, be it as a gynecologist, be it as a general practitioner, be it as a psychiatrist. They are conscious about it, that they should do their best. This is one aspect which is less understood about women, is that they are much more conscious about that whatever role they are doing in the hospital or at home or in the kitchen or as mother or as daughter-in-law or as wife, they should do the best. And most husbands across the world, they're very poor appreciator, very poor admirer. So whenever a compliment comes to a lady, she beams, she feels happy, she feels validated, she feels endorsed that my efforts are being appreciated by at least someone. We usually have nasty comments about it. The women feel happy about when they receive compliment. It's not just that. Since they have a desire, they have a commitment, they have an inbuilt programming to do the best in every role, and they are not sure because they have multiple roles going in the mind. So even as a doctor, if I'm a patient in the hospital, if I say, Doctor, so nice of you took time to come to hospital in time. So nice of you are forgetting your family responsibility, you're taking care of patient like us. Even this 30-second sentence matters to a lady doctor. How many people do? How many people really care that we should acknowledge? So we decided to take up this topic what COVID returns challenges to lady doctor is much more acute, much more severe than what otherwise remaining medical fraternity is facing. How many of us can believe that so many women feel so deprived they can't hug their children? They don't have time to take out their hand from the PPT and call their son or child or small baby or big baby. Or they can go home comfortably and they can eat with their children. And they don't have the liberty like men do have it. They don't have that kind of liberty what men can have it. Now, these areas have not been touched upon by any section of society or any section of administration. And this is high time we talk about it. This is high time we take care of the lady doctors so that they can discharge their duty in much better way, more efficient way, happier way than what they have been doing. So thank you, Mr. Lal, for giving this platform, giving this opportunity for me to share some of my views. I look forward to hearing from all the 4 ladies from different backgrounds, and they would speak their experiences and would help us.
Thank you very much, Dr. Anand. And what Dr. Anand has made one important point is that the society is not acknowledging the efforts, the tireless efforts of the lady doctors, the female doctors who are working day and night to save so many lives, because they are, and according to Dr. Anand, they are more caring, more emotional. Many times they are there as a mother, sister, and they are performing their duties, forgetting their own life, own family life, forgetting even that their small child is waiting at home. So when he says, when such type of thing, why no political leader, no social leader, or not a single one is caring, talking about the lady doctors or those who are working tirelessly in this profession. Thank you very much, Dr. Anand, for raising such a good point and opening the eyes of the society. After all, forget about the leaders. If leaders cannot be our role model, no problem. We have to become our role model. We can appreciate, as Dr. Anand has mentioned. Why not? We can't appreciate them. After all, they are working for us. They are not working for themselves. At this difficult time when nobody wants to even touch or nobody wants to go to the near to a COVID positive patient. Thank you very much, Dr. Anand, for giving your views.
Mr.
Yes.
Lal, 30-second intervention. Today's program and today's topic is a small step in that direction. For
Okay,
all those who ask about why this topic, this is the answer. Let us at least appreciate the women's center.
Thank you very much, Dr. Anand, for saying this. I'm sure that all our viewers will rethink and think 10 times why not they should also start appreciating those all and especially the lady doctors. They are working tirelessly. Thank you very much, Dr. Anand. I would like to invite my next panelist guest, and she is Professor Girja Wagh. Professor Girja Wagh is MBBS, MD, FICOG, FICS, Diploma in Gynae Endoscopy. She is the Professor, Department of OB-GYN, Bharati Vidyapeeth Medical College Hospital, Pune. She is Senior Consultant of Cloud9 and Apollo Hospitals, Pune. She was Chairman Medical Disorders in Pregnancy Committee, FOGSI 2012 to 2016. She is the Vice President, India Chapter Gastrosys since 2014. She was Member Governing Council ICOG from 2011 to 2014. She was Joint National Secretary FOGSI 2010. She is Assistant Coordinator National Eclampsia Registry since 2008. She was the member of Central Supervisory Board of the PCPNDT Act 2010 to 2014. She is National Mentor Lakshya NPO QCN, Ministry of Health and Family Welfare, Government of India. She won the prestigious Anandibai Joshi Award for Excellence in Medical Services. Welcome, Professor Girja Wagh, on our show. Professor Girja Wagh, you have heard what Dr. Rajiv Anand has mentioned. And you have already heard, so no need of repeating me that. Definitely, we would like to know from you your own experiences, the experiences of the students who are studying under you or who are working with you, and all the experiences and your own views about the COVID returns impact on lady doctors. Professor Girija Wagh, please.
Good morning, everybody. Namaskar from Pune. And at the outset, I would like to first congratulate Dr. Lal Goel, sir, for having this wonderful platform, and Dr. Rajiv Anand for appreciating and acknowledging the contribution of women and their role, not only in the family, but also in the profession. Before I embark on my next 9 minutes of talk, I would like to all the panelists to please put their hands together in prayer to wish for the well-being of all of those who are ailing from COVID at this point in time. There are many colleagues, there are many relatives, there are many people in the community who are suffering, and to pray for all those whom we have lost in this COVID pandemic. And sometimes it has been extremely sad and frustrating, but I feel in the helm of this affair, women, as depicted by Dr. Rajiv, we cannot forget that we have to stand by, as always, as strengths of pillars of strength all the time. When the first pandemic hit us, we realized that we had to keep on striving despite. That time we started having a staggered kind of a duty. And then we felt that we have really realized and achieved that particular goal of taking COVID away from our country. But unfortunately, it struck us bad in the second wave. And this time on, friends, the people who are hit the most amongst all the communities, younger people seem to be hit most. Younger women, and usually pregnant women, and that is really, really a cause of concern for us as a gynecologist. So gynecologists and OBGYN specialists can never go out of work if they have chosen OBGYN as a practice. When I was a young doctor practicing in the University Medical Hospital, I remember my head of the department telling me, see, you have chosen to become an OBGYN, even if you have small children at home, you will have to come for emergency duties. You should have then chosen anatomy or physiology as your specialization branch. You decided to become an OBGYN specialist, so you have to continue to be committed. And those words keep on ringing in my eyes for so many years now. I'm in practice for the last 29 to 30 years. Not even a single day or a single moment I feel that I have been away from my patients. And I feel that is the only little bit that I can do for my society. If you would ask me, how do we balance this on the family front? See, on the family front, it is important that just by your own behavior, you inspire your own family. I know my own two sons. One of them is a doctor. He has currently chosen to work in the Jumbo Center in Pune. And I was extremely proud of him. He never felt that I am Dr. Wagh's son. I can go to a privileged center to work. He said, no, there they require a person like me who will be able to be committed. I think our own actions inspire people. We should not waste time in thinking, am I a weakling? Are people appreciating me? Are they looking after me? No. Let's try and look at this at the same situation that I would look into my family. For example, suddenly there are 5 people who have come down in the evening saying, relatives have come, they said, Abhi khana hai, humko bhook lagi hai. What do? You cook something and you feed them. You don't waste time in thinking and giving reasons. That is exactly what has happened here in the pandemic. That we have to continue to hold our things together. Dr. Anand at the outset asked me, how do you manage your time? The simple thing is, in the night before I go to bed, I use the Google Calendar. I put everything on timelines and it keeps on giving me messages lest I forget. I put my tasks similarly as I order grocery and grocers from my house. Now, the challenge has been that women have to work on the home front as well as they have to work on the professional front. In all these places, better planning and visualization helps. What is the single message that I give to my patients and my colleagues is, be very, very positive, because positive affirmations is only going to help you build up your immunity.
It's 11 hours.
If you become very, very negative, in that negativity, your immunity will suffer, your work will suffer, your commitments will suffer. You may get angry, you may not be able to commit to yourselves. A message which I want to give to the community is please follow social distancing. I see when patients come to the OPD, many times when you tell them that there is a telecommunication mechanism, we can do online consultations for you. Please book your appointments. Sometimes, patients are not very cooperative. What they will do on one side, they'll say, Doc, I can't book the appointment. Sometimes they'll say, Doc, I can't make payments. A lot of excuses are given. Sometimes they say, no, we want to come and see you. See, we have to stagger our care because we should not ignore the ones who really need that care at that time. And usually pregnant mothers do need to come to the facility. We are using a lot of guideline protocols where we are able to sort of, make proper, efficient antenatal visits, proper, efficient gynecological visits. I want to take this opportunity at this particular forum to appeal to the community that please be cooperative. One more thing, Mr. Lal, which we faced during this pandemic was all our WhatsApp numbers were open to everybody because we did not want anybody to be away from here. But, there were some miscreants who still till today continue to take disadvantage of that. They'll make a phone call. We pick up the phone and then there's some sort of abuse, some sort of very bad things being said. Now, I am an older woman and I'm much more experienced in the ways of life. So I don't get affected. But I'm sure my young colleagues are really, really disturbed with this kind of things made. So we are coming on the social media much more often, not to publicize ourselves, but to reach out to you. Please make most of it. And that would be my appeal to everybody. As far as having or not having maids or people in your house for work is something that each one of us has to individually decide depending upon the architecture of our homes. My maids come at a fixed timing every day, and when they leave the house, they sanitize the entire space and go. This is what practice we have decided. And believe me, for the last 2 years, my family and we have never sat together to have any food. We don't watch television together. We are always isolated in our own rooms and we connect only on our mobiles. So within your homes, follow social distancing. You may say that, doctor, you have been a doctor, where you have experienced anything. At this point in time, 10 of my very dear family members are ailing from COVID at different parts in the country. 2 of them are very serious. I have lost 3 relatives, very close ones to this pandemic. But through this time, as a doctor and as a woman of maturity, I've decided to keep my own control. I have decided to be in control of things. And when my own father of 90, who is dementic, was admitted in the hospital, I personally had to go there to the COVID wards to look after him. And when I spoke to my sisters, we decided that we'll take a call. If he decides to needed to go on the ventilator, we are not going to take him there and make him suffer more. We were very fortunate and lucky that he came out unscathed through that particular episode, and he continues to be happy now. So these are small things which I felt that we all have to remember. At the end of this day, I would just want to say, be grateful. Be grateful for everything that you have. Secondly,
one moment, please.
Yes.
One moment.
And have healthy food, healthy diet, healthy exercise, and good rest. Positivity is important. Thank you so much. Thank you, sir.
Thank you very much, Professor Wagh, for giving such a positive vibes and positive thoughts of you. And what Professor Wagh has said, 2 important points. First point is when she said that her own son, who is a doctor, and with her influences and with the privileges, she would have get him placed in a very high hospital. But she chose that the son chose that he wanted to work in a jumbo center where all the COVID patients are there. Now, this shows the dedication for the humanity, dedications for those to serve the humanity. And second point, which she made, a very, very important point, and that is that people are still not coming out from their own mentality. They are calling, and especially to the lady doctors, and they are giving calls, they are abusing, or they are talking in a very vulgar way, which is not at all acceptable. We are in a civil society. This is an emergency time. How one should understand that their own near dear own family can also be a patient tomorrow. And if you are doing like this, and if you are disturbing the doctor mentally, how the doctor will be able to serve, and especially a lady doctor will be serving the patient. Thank you very much, Professor Girija Vyag, for giving such a important point. And I feel that the society has to rethink that how they are behaving with a lady doctor. They should not do like this. After all, they are working 24 hours to serve the society. And if we are not if we are not grateful to them, at least we should not abuse them. Thank you very much, Professor Wag, for your views. Now I would like to go to our next panelist guest, and she is Dr. Bhavika Hochandani. Dr. Bhavika is MBBS, DHA, PGCT, Geriatrics and Palliative Care. She is a palliative care and geriatric physician. She is the co-founder and director of ISNE Elder Care Private Limited. She is trustee of ISNE Foundation. She is the assistant secretary IMA CGP Mumbai West. She is having experience of over 20 years with general medicine, critical care, public health, geriatrics, and palliative care. Welcome, Dr. Bhavika Hochandani on our show. Dr. Bhavika, you have heard what Dr. Rajiv Anand as well as Professor Girija Wag has mentioned. And both were very, very clear that they are ready to serve, that lady doctors are ready to serve and they are serving. But the society has to change their mindset. Few of them, I will not say that everyone, but there are many who are creating unnecessary problem for the lady doctors. Although the lady doctors' responsibilities are far more than a male doctor, because they have to take care, especially in India, take care of the entire family. They have to take care of the patients, and they have to take care of their own self. So now we would like to know from you the COVID returns impact on lady doctors. Dr. Bhavika Hochandani, please.
Good morning, everyone. Thank you, Mr. Goel ji, for the kind words. Thank you, Dr. Rajiv Anand, for this opportunity to speak to this august audience. COVID-19 has once again created a havoc in the second wave. The challenges faced by the healthcare workers are tremendous. All working women across the globe are facing immense hardship. Women doctors are facing an ever-increasing demand on their time and on their resources for patient care as well as care of the family. And balancing professional and personal life has just got tougher. The impact is humongous. Today, I will highlight some of the challenges faced by the women doctors, the effects, and the coping strategies. Like many other doctors too, I have also recovered from COVID, and I can identify with all the challenges faced by a doctor and the patient itself. There are a lot of stories and grit and gumption during these COVID times. A lot of doctors who are facing a lot of emotional health issues. And then we need to do something about this. Amongst the various challenges faced by the women doctors, the foremost is balancing a professional and a personal life. There are a diversity of personal situations at play. Sometimes managing children's classes online, managing the activities at home, taking care of the elderly, cooking meals, all the housework in the absence of house help. There are no caregivers for the elderly. Then to manage one's own health, comorbidities, all this is taking a toll on the women doctors. On the personal front, there's an increased workload, teleconsultations, physical consultations, intense emotional trauma, seeing the elevated mortality and morbidity of patients, wearing PPEs for long hours, explaining poor prognosis to patients' relatives is indeed takes a toll on the mental health, counseling the close ones of a dead patient, and the list is endless. The impact is so great that it affects the emotional aspect of the lady doctor. Striking balance is extremely tough. Yet another challenge is treating your own family members who are COVID positive at home and in hospitals. This may be associated with a lot of insecurity, self-doubt. Sometimes you wonder, am I treating as per protocol? Did I go wrong? Self-balance, self-blame in the case of death. Suppose a relative dies under your treatment. You tend to blame yourself. Did I miss something? And this may lead to a lack of self-confidence. Then there are a lot of myriad of emotional problems they are associated. There's a lot of anxiety associated with the disease and anxiety associated with the treatment. There is fear, there is depression, there could be panic attacks, a host of psychosomatic symptoms. There's also increasing fear of carrying the virus home, of infecting your loved ones. This is leading to voluntary self-isolation from the family, like Dr. Wag pointed out. For so many who have suffered COVID, the anxiety associated PTSD or a post-traumatic stress disorder could pose yet another challenge. Now let's discuss the long-term effects. On a positive note, women doctors will have greater strength, greater resilience. They will have more self-confidence to deal with all the adversities, and they shall come out as winners. But few may have long-term anxiety, depression. Few may want to give up the profession because they cannot cope up with the demands of work and home. While the pandemic rages on, we can do with some coping mechanisms. So what are these coping mechanisms? Give yourself some me time. Every woman doctor should give 15 to 30 minutes to herself, by herself. Explain to her family the need that we require this time, we require this space. You can just sit and do nothing. You can meditate. You can listen to music, what you like. You can indulge in a hobby. You want to write something, pen down your thoughts. Deep breathing and relaxation techniques. A lot to be done, but you do need time for yourself. Along with nutrition of others, please take care of your own nutrition. Have some regular exercises. You could do yoga, pranayam. That will help in relieving the stress. At work, situations get overwhelming sometimes. So take a short break. When you no longer can function, take a short break to just rewind, just to get away from that and then go back with a renewed vigor. There are support systems. There are a lot of support systems existing. Women doctors can talk to family, to friends, to siblings, to other doctor colleagues about the challenges. You can talk about your day, about your fears. Talking and venting out emotions helps to de-stress. There are many women doctor groups on social media like Facebook, where women doctors across the globe are sharing their own problems, both at work, at personal life. Discussions in the group, advised by the other doctors going through similar problems, help to relieve the stress. One identifies with the other colleagues on similar situations, and you feel you're not alone in dealing with the onslaught of the pandemic. This feels that your situation is better than many others, and you get a sense of encouragement from your own colleagues. The next is that when there is fear, anxiety, they become persistent in your life, sometimes depression, suicidal tendencies, seek professional help. There are a lot of psychiatrists, a lot of counselors just waiting to help. Remember, help is just a click of a button or a phone call away. Do seek help when necessary. So I would say the takeaways would be: identify the problem, talk, take support, seek help at the earliest. Also, let's hold on to the hope. Let's hold on to our resilience. We shall overcome and we shall win this battle. Thank you.
We shall win this battle, says Dr. Bhavika. And what Dr. Bhavika has raised a very important point. She says, because of the so much pressure on the doctors on the work front as well as at home, at least 15 to 20 minutes they should give for themselves. That is a me time. And the families as well as the working place, they all should understand that this me time is very important for a lady doctor, because in that time she can do something without thinking about the work or thinking about the family. And that is very much required, because she says the pressure is so much at this COVID time that the lady doctors are going in depression. They are thinking to commit suicide, and many things which are coming, negative thinkings are coming. And especially when a young patient dies in front of them, then she starts thinking whether I have done something wrong, I missed something, and which is why they lose the confidence. And for that, she says that we must, her advice to all the lady doctors are that please go for a me time for 15-20 minutes. Just rejuvenate yourself and think that we are far better. We are doing a social service, service to the society, and then again do your work with full zeal. Thank you very much, Dr. Bhavika, for giving such a positive views. I'm sure all the viewers, irrespective whether they are lady doctors or not, they all understand what is going inside and what is being in the mentality or the psychology of a lady doctor. Thank you very much. Now I would like to invite my next guest, and she's Dr. Aninda Sidhana. Dr. Sidhana is the consultant psychiatrist at Shri Ganganagar. She is a mental health professional with a difference. Having her roots in the field of mental health and family background of psychiatrist, she had her exposure towards nuisance of mental health since very young age, with a dual experience of 10 years in a general hospital psychiatry unit as well as a tertiary care neuropsychiatry center. She is well equipped to handle both severe and chronic mental illness as well as common mental disorder, and is being trained in psychosexual medicine. Hailing from Rajasthan, Sri Ganganagar, and dealing with patients from both rural and urban background, trained at the prestigious Institute of Human Behavior and Allied Sciences, she uses an integrative approach to achieve a state of optimal mental health and well-being for her patients. Her range of expertise includes stress management, addictions, marital therapy, and psychosexual disorders. Being a female doctor and dealing with sexual issues and also addictions and various mental health issues, especially in a small city, is quite challenging. Welcome, Dr. Anindya Sidhana on our show. Dr. Sidhana, you have heard of what Dr. Rajiv Anand, what Professor Girja Wagh, as well as what Dr. Bhavika has mentioned. And they have given their views, the reality, the real experiences of them, that how the lady doctors are facing tough time during this very, very difficult time of the pandemic. Now, you being a psychiatrist and you are dealing with the patients, and you are dealing in a, as you have also mentioned, that you are dealing from a city not as big as Pune or Mumbai. So basically, the rural as well as urban urban population is there, rural population is there. They are your patients or the clients. Definitely, their problems are quite different and more challenging than the problems in metro cities. Now, we would like to know from you the COVID returns impact on lady doctors. Dr. Anindya Sidhana, please. Please unmute. Please unmute, doctor.
First of all, I would like to thank Dr. Lal Goel and also respected Dr. Rajiv Anand sir for giving me the opportunity to share my views. And yes, Dr. Rajiv Anand sir truly said that since yesterday we have been getting messages, are lady doctors different than the male doctors? So I would like to thank our male counterparts and the male doctors also, who have been working endlessly and tirelessly in this COVID pandemic. But there are few things in which lady doctor has to face as compared to the male doctor. Work-life balance has been discussed already. So I would like to mention few case scenarios. As in, first of all, the hormonal changes and the menstruation problems. The first wave of COVID, which was there that time.
Excuse me, doctor. Can you just shift your camera towards the other side, because you have to be in center. It's a live telecast, so you are at one side right now.
Yeah,
just
fine?
No, just shift yourself. Yeah, but somewhat more. Is it possible?
Okay. Is it
The other side, doctor. No, yes, please. Now, please go ahead. Thank you.
So first of all, I would like to tell the problem with the menstruation and the PPE kits, which is definitely not faced by the male doctors. So there is the question which everyone is asking, are female doctors different than the male doctors? So last wave of COVID-19, the duties used to be for 4 to 5 hours. But in this wave, the female doctors or the male doctors, everyone has to, they are not getting the time to take even tea or even go for the washroom. And during the menstruation period, they have the pads soaked up, menstrual cups filled up. Dysmenorrhea is a major problem, which is very difficult for the female doctors to face. And then another thing is lactation. I have many friends who are during the lactating stage, and they have to go for their COVID duties, and wearing the PPE kit during lactation phase and weaning of the child from lactation at such an early stage is very affecting the child's health and the mother's health also, because it leads to breast engorgement, heaviness, pain, and one being in the PPE kit, it's very difficult. And also the child uh, gets the physical bonding with the mother, and the oxytocin hormone is released with the sucking reflex. So, which is causing the decreased physical bonding, and it's going to affect the mental health of the child in the later period, and also of the mental health of the mother. Then third point, when female comes back from the duty, long duty hours, she has to take a break or isolate herself for few hours, sanitize herself, and stay away from the kids. And she cannot hug her kids. She cannot be physically available for her kids. And kids long for their mother's presence. If it's okay if a father comes and says the child, okay, I'm busy, let me talk to you later. Child will not be affected much as seen, but child gets disappointed if a mother refuses to hug the child or refuses to meet the child as soon as she comes from the job. And then another thing which has been, the survey has been done in which it has been shown that 70% of the females are the caregivers of the family. Uh, as we all know, most of the lady doctors have their husbands who are also doctors. So they are also working endlessly and they are managing their duties. But still, even if they help in the household work, but it is ingrained in the female's mind that she has to be perfect, as mentioned by Dr. Rajiv Anand, and she has to be perfect. She has to serve her kids, she has to serve her in-laws and everything. She has to manage. So when a male counterpart goes to the duty, he does not have in his mind whether sugar is over in the house or whether milk is available or not, whether children has eaten or not. But a female will always have all these things in her mind. And there has been a survey and a study in which it has been reported around 58 to 62% of the females have suffered from anxiety during this pandemic, the anxiety of exposing their children and fear of contamination and the fear of exposing the children to COVID-19 after coming back from the duty. And also going into depression for not meeting their children and just talking over them on the video calls. In China, it has been seen more than 80% of the healthcare workers are female, and also more than 80% of the workers are females are caregivers. So female has to take care of the elderly of the house, the mother-in-law and everyone. We can talk like, yeah, my husband makes a coffee in the morning. My husband helps me in household work. But female herself has this ingrained in our Indian culture, especially Indian society. She is ingrained to fulfill her all the duties with perfection, and she does not feel the satisfaction if she is not able to feed her child properly. And then there the child care facilities were shut down due to the COVID-19. So she had to divide her work in the child care also. Then regarding the online classes, earlier children used to go to school and were busy there and were being disciplined by the teachers. But during this COVID pandemic time, everyone has to attend the classes online. So kids who are of age of 3 to 4 years of age, 5 years of age, they cannot attend them just alone. A mother has to sit with the child to tackle that situation. Then there is a also a father can sit with the child, but the patience level of the female is definitely higher as compared to the male, which I feel and which I have come to know. And many colleagues come to me as being a psychiatrist, they come to me, they are suffering from the burnout due to this pandemic, and they are not able to uh, take care of their children, take care of their in-laws. They are not able to fulfill their responsibility because of the pandemic. So they are feeling a lot of burnout. And I have to consult them regarding that you are doing your job best, but some of them have opted for the teleconsultation also. Though still, it's their job. If okay, psychiatric consultation can be done teleconsultation, but gynecs, other physicians, ICU intensivists, they all have to go to their duty, and burnout is definitely there. So I have to consult them regarding they can leave about the perfection. They can think about like they are fulfilling their duty. And yes, it is a difficult time for everyone. The pandemic is difficult time for everyone. And the second wave is very frightening. Every day we keep on getting calls regarding from the family member, someone is sick, not getting oxygen, and saying no to them is very difficult. And also, I would like to quote that 15% of the women have increased work pressure and have had difficulty in maintaining the child care. The child care is very important in this case. Then another thing, the point I would like to raise, there is a lack of data regarding vaccination among the pregnant women and also among the women of the fertile age group who are planning for the pregnancy. Recently, we have seen a death of a psychiatry resident from Mumbai who was pregnant and was not vaccinated and got COVID positive, but she's come to death. On the other hand, her husband had only mild symptoms because he was vaccinated. And there is lot of confusion, lot of lack of data and research regarding vaccination among the pregnant women. And even during the pregnancy, childbirth, lactation period, you can take leave for 3 months, 4 months, but not forever. One has to go to the duties. So that is also females are at higher risk because vaccination is not being done properly. That is the case. So we need to research the vaccination thing. Then, other than that, there are many hormonal changes which come among the females. First of all, every female has to go through menstruation during every month in which estrogen levels change and which cause premenstrual syndrome, which is very common. I have seen, and it leads to irritability, frustration, at times decreased interest in doing any work, but still they have to do the duty. So that is a difference between a male doctor and a female doctor. And then there are many gynecs, many women who are in their menopausal age. So hot flushes, irritability, mood swings is another problem with them. And wearing PPE kit and having those hot flushes is very difficult to handle. So these are few points I would like to highlight. Then there is a it has been seen that uh, many females they have the apprehension and fear of contracting and contaminating their in-laws. They prefer to stay at their parental house because in Indian society there is a prevalence that female has to look after the in-laws, and it is a undeniable fact. Though society is developing and people are males are also helping, husbands are helping, in-laws are also supportive, but still in rural area there are many females who get various comments like she does not do any household job, she does not come to home at time. Then Dr. Lal initially mentioned regarding the staying facility for a female at Lalit Hotel. Okay, that was a male can stay at the hotel, but in rural society, if a female stays out of the house for a night, that becomes a problem. If not for the close family members, but for the neighbors, they get the talk, they get to gossip and talk bad about the female. Then another thing, a female will always have on her mind whether the groceries are there. Okay, I understand domestic help is available for everyone, but during this period, domestic help is was not like people didn't prefer domestic help to help them in the kitchen in cooking and especially feeding their children and the in-laws. So female had to look after that responsibility also. So that is the impact on lady doctors specifically, which I feel. And burnout is very high among the lady doctors. Then in US there was a study in which they told like lady doctors, they 6% of them had to change their work hours, while 25 to 30% of the female doctors voluntarily increased their work hours out of concern, out of the ingrained empathy to help the society. And also there is a major concern among the female doctors, female staff. They keep on talking to the nursing staff to build up their morale. And also the being a female psychiatrist, many patients come to me uh, asking about the prognosis of their patients admitted in the COVID ward, and they feel better crying in front of me instead of going to a male doctor. So, which causes a lot of burnt on me also. Uh, but we have to stay positive in the situation. And then I have been getting calls from my family, friends, especially from the college friends who are working in all the departments and are going through the pandemic and having a lot of burnout. This burnout, the people whose husbands are not doctors, whose family members are not doctors, they are not able to understand the situation, and they are not able to understand the work pressure female doctors are dealing with. So there have been a lot of marital discord, and I have been uh, listening to many people uh, saying that my husband does not understand, like I have to stay isolated, and they don't understand that I am also tired, I also need some rest, because they are non-medicos, or some are non-educated also, which leads to relationship conflicts. Then there is also the sexual problems which are arising due to the COVID-19 among the that is a different aspect that is also arising. So the few points like impact on lady doctors is like, first of all, the lactation period, which is very difficult. For 5 months you can take leave, but after that you cannot take leave, and the no child not getting the breast milk, female not getting that sucking reflex and the oxytocin hormone, which causes the physical bonding between the mother and the child, is definitely going to affect the people. Then the lack of physical bonding between the mother and the child, then the menstrual problems, long hours in PPE kit, and definitely managing the work-life balance is important. And it is a duty of a female to look after the family. And definitely I'm thankful to my male counterparts also. They are doing their job endlessly and tirelessly. They are serving the society. So it's like all the doctors are doing their best. But yes, we should be concerned about the lady doctors, just because there is everyone says people don't understand women. So that are
Okay.
various problems. And the vaccination part, I would like to highlight. Now, Foxy has come with the recommendation to vaccinate all the females. Even if they are going for treatment for infertility, they should first get vaccinated, because we should not lose more doctors like that. Thank you.
Thank you, Dr. Sidana, for giving a very detailed description about the hurdles or the problems faced by a lead doctor. I would like to just highlight one, which she has made a very, very important point. And the important point is that those lady doctors whose their spouses are non-medicos, they are not understanding the condition, the seriousness of this particular disease, because in this COVID time, the lady doctor has to be isolated. They have to keep a social distancing, and sometimes they have to stay outside the house, either in a hotel or in the hospital, wherever the government or the concerned hospitals are putting them. And that's why the problems start. So my appeal to all those non-medicos, because medical doctor knows what is the condition, they knows about the situation, but the non-medicos, they should understand that after all, it's a need. It's a such a thing where they are doing the very, very great service. No one else is doing great service what a lady doctor is doing. So please give some time. Once this COVID will be over, then definitely they will be giving more time to you all, when like the earlier time. Thank you very much, Dr. Sidana, although you have made so many points, but I would not, paucity of time, so I will not be able to summarize, but I'm sure the viewers have understood what you have spoken very, very clearly. Now I would like to go to my next guest, and she is Dr. Gauri Gupta. Dr. Gauri Gupta is MD, DNB, DGO, FCPS. Dr. Gupta is the practicing infertility consultant. She is the medical director of Desire IVF Mumbai. She is practicing as infertility consultant for last 12 years. Numerous research publications are to her credit. Welcome, Dr. Gauri Gupta on our show. Dr. Gupta, you have heard Dr. Rajiv Anand, you have heard Professor Wag, you have heard Dr. Bhavika, you have heard Dr. Sidana. Now we would like to know from you your views on the COVID returns impact on lady doctors. Dr. Gauri Gupta, please.
Hello, everybody. Thank you, sir. Thank you, Mr. Lal Goel, for this wonderful opportunity, and Dr. Rajiv Anand, sir, for giving me an opportunity to be here and share my views. So, as everybody has rightly put in their views, and definitely the question which arises to everybody's mind, why women differently? So, the very first thing is that women are the primary caregivers in the house. A woman always feels responsible for what goes in her house, as well as being a lady doctor. She's always feels herself responsible for all the patients and all the people who come to her clinic and look up to her for giving the required care. Similarly, she feels equally responsible for everybody at home. So, in this COVID pandemic, what has happened is earlier she was able to do both of these duties very well. But this being an infectious disease, she was not able to maybe come back home, give the amount of care for the fear of transmitting the disease to her loved ones, especially her children, her in laws, her parents. So, this was the main cause, and of course, the time and the anxiety which all took over. Women always have this thing, like Dr. Anandita said, of being perfect. You want to be a perfectionist everywhere. That also takes a toll somewhere. There are many people whom I know who want to do very much the perfect way in life, for their family, for their this, but somehow this pandemic has torn them apart. Somewhere they couldn't find the balance between work as well as the children or family, which they need to. There are many families or many friends whom I know who had to keep their children way back in their native place with their parents or maybe in-laws for the fear of transmitting the disease to the children. So there were months on end during the initial part of the pandemic where they have not seen their children. So the only thing they were doing was video calls, conferencing. So all that has taken a toll, definitely. In fact, I would also like to bring to this notice that me as a practitioner has also come across many patients who came to me who were doctors, somebody like a dentist, somebody like a physiotherapist, who came to me for vague complaints, gynec complaints. But upon further prodding, because I thought that there was no such symptoms as they were describing, upon further prodding, it was understood. It was just the fear, it was just the anxiety. It was not somewhere very young as 24, 25, just out of college, practicing right now. But because of maybe pressure from parents, not able to go, not able to dispense their duties, not able to cope up with everything. So it is more of the psychological support than they needed, than any other medical help. And Dr. Rajiv Anand would agree to it that I have, got back in touch with him for so many such cases during this pandemic. So basically, these were the things, like even educated people like doctors have to deal with this psychological impact which this pandemic has created, because nobody ever thought of suddenly there would be a lockdown, suddenly you won't be able to meet your near and dear ones, suddenly all your outings would be seized, suddenly you cannot meet your friends. So this has something really taken up a toll even on educated, well organized, so-called lady doctors, and everybody. We are also humans like everybody else. So of course, like we have a group of friends right from our college days, and we have a WhatsApp group. Every time it used to be discussions on the COVID issue. So we decided, let us not do this now, because every time we used to read it, the same views we get on the TV, the same views we get on the WhatsApp. So there was no point in getting the same negative views again.
Yeah, please go ahead. Sorry. I've muted. Yeah, go ahead.
So what we decided, let us have a fun-filled WhatsApp group this time, wherein we exude positivity here, wherein we tell what we are doing nowadays differently, like maybe a hobby, or maybe it could be anything like painting, drawing, or hobby. So this really helped us, or maybe share something nice about our children, something different than what actually is going on in the world. It's something like not getting out of reality, but then focusing on something different, wherein anyways you are doing whatever you can in this pandemic to keep yourself safe, but why not something of positivity? So we also came up with, you all must be very aware of this happy doctors video, which went very viral, like happy doctors 60, which even the PM appreciated a lot during the earlier days of the pandemic. This was just to exude positivity everywhere, and that's it. And we also had things like many of our friends, many of my friends have also uh, been into depression, I would say, being lady doctors. Uh, Leave around that, they also have been physicians. They had to take care of a lot of mental stress, physical stress. They ended up having diabetes and hypertension during this pandemic. A very close friend of mine, right from childhood days. So these are few of the things which this pandemic has done to us. But there are a lot of ways which we can try to cope up, like indulging in something different. What I would definitely like to say is that keep away from negativity. Try to not control everything which is not in your hand. A lot of negative news and a lot of COVID updates, it's not going to help you. The only thing which is going to help you is to keep yourself, your staff, and your family safe. Focus on that first. Don't focus on the national issue. You are not going to add up. You are just going to do your bit by doing your bit well. That is what I would like to say. Keep your mental moral high. Practice something that you like. Maybe it could be yoga, meditation. Develop a hobby or nurture a hobby that you already have. Find your peace in this chaos, and definitely do not try to be very harsh on yourself. Nobody is a perfectionist every time. Love yourself first so that maybe you can exude love to your near and dear ones more. This is all I would like to say.
Thank you very much, Dr. Gauri Gupta, for giving your views. I will just highlight one view which she has mentioned is be away from the negativity. And she says that you cannot do many things like what is happening in politics and others if you are not in the politics. Please concentrate of that you, yourself, your family, and your associates are safe. And for that, be away from the negative totally. If you will think of all those things, then you will be just a moment, please. Dr. Aninda, I have to keep you mute because some disturbance is coming. So please be on mute only. Once your turn will come, then I will definitely, you can unmute. So now what Dr. Gupta says is the negativity is creating lots of problem, which as a psychiatrist, she is coming across so many cases where the patient is developing the diabetes and other diseases. So one has to be very, very positive. Even if you are on WhatsApp group, please see to it that you are not talking only about the COVID, but do something which will give you happiness and keep your family also happy. Thank you very much, Dr. Gupta, for giving very, very positive points, as well as a very points which I'm sure our viewers are going to follow, because you have given those points, and especially when you said the lady doctors are facing problems mainly because of their negativity which is going on. So for all the lady doctors, all the health workers, female health workers should be away from this negativity. Thank you very much, Dr. Gupta. Now my question goes to Dr. Rajiv Anand. Dr. Rajiv Anand, you are watching the lady doctors from the time when you have started studying in a medical college. At that time and now, what change you found in the lady doctors? Earlier, the lady doctors were generally in the gynec. Now they are in almost every field of the medicine or the surgery. Their challenges, has they increased? What the challenges were there initially, although at that time to become a lady doctor was very rare, means that the society was not at that time so advanced, but today society is ready to accept the lady doctors. But the challenges were there earlier more or now, and especially in this pandemic time? Dr. Rajiv Anand, please.
Thank you, Mr. Lal. My answer to your precise question is that the time had changed, society had changed. We all have moved a lot from conservative attitude of 1 out of 100 in the society being a lady doctor. Now we have much more. Personally, I would be of the view that major section of medical world should be handled by lady doctors, except few specialties which I would leave it unnamed, where a lot of other problems might be there or strength is required. Otherwise, most of the discipline in the medical world can be handled very efficiently by the lady doctors. Just, I would take a minute more to comment on something. Every lady doctor from Bhavika to Ananta to Girja to Gauri and to 1,000 others who are listening, and not only lady doctors, rather all the ladies are capable of far more efficient functioning if society in general, man in particular, you and me also in specific, stop commenting on them, comparing them, and criticizing them. If we do away with this 3C, commenting on them, comparing them with others, and criticizing them, because that demoralizes them. Otherwise, they are capable of achieving much more than we can ever think of. Thank you.
Thank you very much, Dr. Anand. Now, my question goes to Professor Wagh. Professor Wagh, you are on such an important post in Pune. And you know, this time is so difficult time. Everyone is running here and there for beds, for oxygen, for medicines. Are you also getting many calls, and how you are coping up with the pressure? Because I'm a non-medico. If I am conducting a program and if I am getting calls from all over India that we want the bed, please organize this thing. I'm sure being such a important post you are, and with such a social context, you might be getting lots of calls. And at that time, sometimes you might be feeling helpless because there are no beds or no oxygen. How you are coping up with that?
Yeah, first and foremost, yes, we do feel helpless and sometimes sad, but then that is something which is an inner engineering that we have to do. Secondly, if we have an access, like I try to be informed about these situations, about what is the status in my own Bharati hospital, my own COVID facility center, like my own private nursing home, 10 beds are given for COVID care. So I usually, and there are 2-3 colleagues, so we keep a tab on where the bed strength is. In the night, we exchange messages so that we know what is available. And if it's possible, we just guide them to those centers. But sometimes you do find helpless, like now, the relatives sitting in Nagar, they are wanting my help. The only thing I can do is assure them, tell them that please trust your doctor, don't go helter-skelter, be calm, and try to find out what is best possible at that point in time. So this is a situation which we have to, at least if nothing else, give them a mental support and assure them that, okay, let's follow, because finally it's destiny in many times. And as Gauri was saying, lot of anxiety is self-created, because if you look at the infection of COVID, 84% infections do not land you in serious disease. Out of the rest of the 15-16%, there are only 3 or 5% who become serious. So let's not get worried about getting only COVID infected. Right now, I'm sitting with a professor in my own room. She suffered after 2 vaccines with a COVID infection. What worked is only being calm. Just being calm and understanding everything, be at home, don't get, sometimes, breathlessness is anxiety driven. You may not be really breathless. And this happens to us every time, The other day, even I was feeling a little sick. I just put on a pulse oximeter and I found it is 93. I said, hey, bhala kya ho gaya? Then I put another pulse ox, it came 100. So, just don't get anxious. Many times being calm and trying to look at resources, not being frantic is important. And secondly, please do not occupy beds in the hospitals if you don't need them. Please do that. There are many people who are just going and staying in the hospital because of anxiety, reserving the bed. जैसे ना हम सीट पकड़ के बैठते हैं अगर कुछ नहीं मिला तो. It's better not to do that.
Okay, thank you very much, Professor Wag. Now my question is to Dr. Bhavika. Dr. Bhavika, you are doing a remarkable work in geriatrics and the elder cares. Now, during the pandemic, especially the last year, the 2020 pandemic, we have seen the maximum effect was on the senior citizens or the elders. How you cope up at that time and how you have convinced them to take care, and even the younger generation, because there was lots of talks about the herd immunity, and few of the my panelists also at media conference, they says let's have a herd immunity. Who have to go, they have to go. Why they are creating a hindrance for those who are not been vaccinated? There are some views that they wanted that we have to go. So do you think that it is very very difficult to convince the elders that they are also respected citizens and they have to live as much as they can? What you say, Dr. Bhavika?
Absolutely, sir. Agree with you. The elderly, by natural tendency, they have a lot of paranoia. All my elderly patients have been frantically calling me up and asking, "What is this? I'm feeling weak. Are there symptoms of COVID?" For every symptom, they associate it with COVID. And since in the media, there's a lot of media reports of the elderly dying, of the elderly getting affected, they are very insecure. So it's very important to reassure them, to listen to them, and also equally important that the younger generation in the house do not go out for unnecessary work and transmit infections, because they are the asymptomatic carriers and transmitting infections. For the elderly, I usually counsel them, tell them to take care of their health, monitor their oxygen levels, not frequently, once in a way, because otherwise they keep on. I have a lot of COPD patients whose oxygen levels are anyway low. So we have to counsel them that these are your oxygen levels. And if there's a dip, then you can contact us. If you are getting these symptoms of COVID and the COVID symptoms are changing, so it may be loose motions, it may be fever. So we are there to help you all. And I think this reassurance helps a lot. Secondly, I'm getting a lot of inquiries about vaccination. Many of the elderly of my patients are at home. So with Alzheimer's, with COPDs on BiPAPs and oxygen itself. So they are asking whether the vaccination can be done at home. So definitely once a vaccination for these elderly will be at home, they will be much more reassured, because after vaccination, they get a certain amount of reassurance. Once vaccination is started, the paranoia has really reduced a lot. So I think it's time we just, give them some time, listen to them and reassure them.
Okay, thank you very much, Doctor. Now I would like to go to Dr. Sidhana. Dr. Sidhana, you have mentioned about the problems which people are facing, and especially the lady doctors are facing. What advice you would like to give to the lady doctors as well as to others, so that the problems which they are facing can be eased out, and especially in this COVID pandemic?
So advice to the lady doctors I'm giving is few of my close friends, they come to me for the counseling, like I slapped my child because I am being burnt out. So I give them the advice, like you take your me time, you do some relaxation, and also just stop being the perfectionist, and stop feeling guilty about not doing all the household duties properly, because this is the time when they have to balance both the things, household and also the responsibilities. And also I have advised them to delegate their duties, like they can delegate the duties to their in-laws, their, or take the help from with the domestic help, they can keep it, but with full precautions, and get all the domestic health vaccinated first of all. That is the advice I give to them.
Okay, thank you, Dr. Sidhana.
So they can, I give them a number, like they can call me anytime whenever.
Okay, thank you very much, Dr. Sidhana. Now, my question to you, Dr. Gupta, is if you want to give any suggestion to this civil society, what would you like to give?
The first and foremost suggestion I would like to give, please get vaccinated. I think that is the only solution right now. Of course, and don't panic. As Dr. Girija Madam has already said, 84 to 85% of the cases really do not require more like more beds or anything. It is just like a flu. So we have to keep our calm. Of course, treatment at the right time is also important. Be very sure your go-to person whom you would like to. If you have got symptoms, if you have got, first get it recognized. First know that it is COVID. Once you know that it is COVID, you know that where you have to take care and who has to be your go-to person. Days 8 to 13 are the most critical days wherein one could land up into a cytokine storm. So these are the days where the person who is looking after you has to be very vigilant and know when you need a hospital or a bed, and whether your oxygen saturations are dropping. And most the last but not the least, uh, washing hands, maintaining social distancing, avoid crowding, avoid unnecessary gatherings. That's what I
Okay,
would.
thank you very much. So today you have seen how the lady doctors are facing the problems, the challenges during this COVID time, and all the experts, all the doctors have mentioned they are working tirelessly, they are working day and night. Only thing they want some appreciation from the society, and if the society is not ready to give the appreciation, they have no problem, but don't abuse them, don't discard them, don't give them something which they are not meant for. Please give them the respect. If you want that they should work tirelessly as they are working, after all they are saving our near and dears, they are leaving their own near dears to serve us. I am sure that civil society has to wake up and give them the full respect. Thank you very much. And today's program has been live telecasted by V4 News, Global TV, V4 Stream, News Gaon se Samvad Sarokar News, as well as was shown live on Facebook and YouTube. And our endeavor is to bring to you every day a new topic. And tomorrow, media conference with Lal Goel. The topic is role of youth in communication. And our chief guest is, along with the 7 youth guests, the chief guest is Mr. Tom Syrick. He's a vice president and business head, Auto Finance, Bhavan International Group Holding LLC, Sultanate of Oman, Muscat. And he will be interacting with 7 youth guests who will be giving their views, and then he will be giving his views. So thank you very much. Thank you all the my panelists, Dr. Rajiv Anand, Professor Girja Vyas, Girja Wag. Thank you very much, Dr. Bhavika. Thank you very much, Dr. Aninda. And thank you very much, Dr. Gauri Gupta, for giving very, very enlightening views of yours and your own experiences. And thank you all the viewers for watching our show. Thank you very much.
There's a, excuse me, sir.
Yes, doctor.
Actually, there's a question in the chat box regarding the management of the psychosis of
the doctor. We will talk afterwards because it's time is over.